Welcome to Hangin at the Reef, where today we'll dive into the pressing issues affecting our environment and discuss the concept of integrative medicine. Today, we're thrilled to have Dr. Allison Bachlet, PhD, ND, with us. Dr. Bachlet is an assistant professor of biology and a pre-health professions specialist in the Department of Natural Sciences at Hawaii Pacific University's College of Natural and Computational Sciences. Dr. Bachlet holds an impressive array of qualifications, including a Doctor of Neuropathic Medicine from the Boucher Institute in Vancouver, a PhD in Pediatric Nutrition from the University of Oxford, and a Master of Oriental Medicine and Acupuncture from the World Medicine Institute in Honolulu. She also earned her BSc with honors in Nutritional Sciences from the University of Guelph in Ontario, Canada. In addition to her formal education, Dr. Bachlet has specialized training in bioidentical hormones, acupuncture, and neuroemotional techniques. Her extensive expertise uniquely positions her to discuss the impact of chemical toxins in our environment and their effects on our health. Join us as we dive into the vital role of integrative medicine with Dr. Allison Bachlet. Welcome to the show, Allison.
Thank you so much.
We're glad to have you with us today. So you are focused on what's known as integrative medicine. I think people hear about terms like naturopathic and holistic medicine, and they're not always sure what those terms mean. Are they alternatives to traditional medicine? Do they complement traditional medicine? Can you first tell us a little bit about what integrative medicine is and how it differs from traditional medicine?
Absolutely, sure. So yes, naturopathic, integrative, they're all a little bit different, but do intertwine. So when we think about our traditional allopathic, sometimes it's called medicine, these are people who have a medical doctorate, a 4-year medical degree, trained in hospitals, they have a certain path. And what we're realizing is, as wonderful as that system is, we often need other modalities and other types of healthcare to supplement that. Integrative medicine is integrating everything we might need. So that might integrate psychology, it might integrate dietetic work, physical therapy, occupational therapy. I am a naturopathic physician, so my background was in clinical medicine and pediatric nutrition. So I did a PhD in gastroenterology, working in a hospital, and then decided rather than the traditional MD route, I wanted to take a more preventative, natural approach in my practice. And I got an ND, which is a naturopathic doctorate, which is also a 4-year medical program. So I like to work in collaboration with MDs, OTs, PTs, right? Everybody to kind of give the patients all the care that they need. Collaborative, I like to think of it as collaborative medicine, integrating the best of all those practices to give patients what they really need.
Well, the word is almost self-explanatory. So integrative medicine is incorporated into and a holistic part of a complete medical approach to good health and medical treatment. What are some of the ways that you integrate or work with traditional medicine?
Well, for example, so some people will think, oh, naturopaths, it's all about herbs. And I'm like, that's not true. In the state of Hawaii, actually, especially, we have a wonderful scope of practice. So, we can prescribe lab testing, x-rays, antibiotics, right? Like we can do all the things that you need in primary care. What I like to focus on is what I'm good at in my natural medicine practice, and then work with other specialties, other physicians. So for example, I might have a patient who's going through chemotherapy. Okay, well, they're seeing their oncologist and their medical team getting cancer fighting treatment, but then we're supplementing that with alternative therapies and complementary therapies that are going to work with that therapy. It's not a substitute for, it's working with. So oncology is just one. I do a lot of endocrinology. So, women going through menopause and perimenopause. Okay, what can we do to supplement what regular medicine can offer? I see a lot of people with anxiety and depression, mental illnesses, ditto, right? What can we do that is either an alternative or can supplement?
So what are some of the common conditions that integrative medicine treats, and how might those treatments differ from conventional practices?
I would say everything. Ideally, I feel like the more we can tackle a health problem from all directions, the better it's going to be. But let me give you an example of something that I was involved in here on the island years ago, and again, recently, is looking at diabetes and type 2 diabetes. So as we know, it's a big problem in the Pacific Islands for a lot of native cultures around the world, type 2 diabetes, also known as later onset diabetes. And this can be really, really modified by diet and lifestyle. And some people know that and have trouble making those changes, and some people aren't aware of that. So traditionally, you might see your doctor once a year, twice a year, and they do a blood test. They're like, oh, you're pre-diabetic. Oh, you're diabetic. Here's your medicine. Like, but that's, that might be it. That's the care that some people might get. An integrative approach would be, hey, you know what? Here's a medicine, right? That's going to help control your blood sugar levels, but there's things you could do. Let's get you into a cooking program that's really going to analyze like what you eat and how you cook. Let's get you into a psychology program that is going to look at why we are attached to the habits that we have, like the process of making change. How do you make changes in your life? Let's get you into physical therapy. If you've got a knee problem and that's preventing you from getting out on a walk every day, well, let's get you into physical therapy and see if we can strengthen those muscles, right? So it's going to be this round approach to tackle a problem from all directions rather than one pill.
So you've called out a few more traditional practices like physical therapy that people might expect to be referred to from an MD.
Right.
What are some of the what Americans anyway might think of as non-traditional applications? I'm thinking, herbs, acupuncture, what of those modalities come into play within integrative medicine, and how important is bringing those additional practices and modalities into your healthcare equation to have a good holistic approach to good health mentally and physically?
Yeah, I think there's a number of them. So you mentioned herbs, and if we start there, so let's stay with the diabetes example. Okay, so traditionally there are several drugs that are very regularly prescribed for diabetes. They're aimed at decreasing glucose release in the body, optimizing insulin. There are herbs that do the same thing. Most of our drugs were based on herbs once upon a time. So there are herbal formulas that you can use in place of those. And I often have a lot of patients that come to me because they are seeking something different. And they're like, I don't know if I just want to be put on a drug that I have to take for the rest of my life. Like, what else can I do? And I say, okay, well, let's work on diet. And the nice thing I find about natural medicine is that we tend to schedule appointments much longer. So we can really talk to people and get to know them and encourage them, say, okay, what's holding you back from getting to your aquafit class or going for your walk or going to CrossFit or whatever it is, right? So encouraging them. And along with that encouragement, we say, okay, let's get you on this supplement that is going to target your mitochondrial efficiency and your insulin sensitivity and your glucose release. And we can use factors. And a lot of times people feel more comfortable with these rather than taking some pharmaceutical that they don't know what it is and they think they're on it forever and they don't understand it. So teaching is a big part of it. And what I say to these people is, if you take these now, this is helping. Let's look at these as a bridge. And then we can analyze in 6 months. And if you're doing all these diet and lifestyle changes, then you might not need them later on. Similarly, I've had people come to me on medication and they're like, oh, I'm still not doing well. I don't want to increase it because there's side effects, right? Like the most common, so metformin is a very, very common first line therapy for diabetes, and it causes a lot of GI distress. I had a patient come to me, she's like, I can't increase my dose. Like I'm already really hurting from this. So what can I do? I'm like, okay, rather than add more medicine, let's add some of these herbal components. So herbs is one. Obviously, I talked about diet modification, kind of lifestyle modification is something we really address. A couple other things that we use in natural medicine a lot is one is acupuncture. So Chinese medicine may or may not be part of a naturopathic practice. It is for me. I did study that. And so I can use either Chinese herbs or acupuncture. And I think acupuncture can be a really wonderful healing modality and adjunct to almost any treatment plan, partly because it gets the person coming back, right? They're getting that constant reinforcement of, yes, you're working on yourself, you're working on your health, you're adjusting energy within the body, and it's a relaxation. And that's really the root of all disease is going to be inflammation, right? So the more that we can get people to actually get into that relaxation state, that parasympathetic state, then you're going to facilitate healing. So acupuncture is another one I use. Homeopathy is one, a little more out there. You know, some people aren't sure of it. I used to have a professor that used to say, always add a homeopathic kicker in at the end. Like, you're never going to hurt somebody. Like, always throw that in as an extra adjunct. And there's certain conditions that I use that a lot. When I'm in pediatrics, homeopathy works wonderfully for children. Absolute wonders. So when appropriate, then that's another modality that we can throw in.
Okay. Well, it sounds like, the treatments that you're calling out, herbs and supplements, they're things that really try to get at the root cause of illness. And it seems like here in the United States, we have a healthcare system that tries to treat acute illness after the fact. So you're getting massive doses of pharmaceutical products, for example. And I think what a lot of folks don't realize is, the baseline ingredients in those massive dose pharmaceutical products are often herbal supplements, plants, things that taken in smaller doses can perhaps balance out your body's chemistry and create a more sustained approach to good health, where you're treating those symptoms through the balance of your chemistry and the right supplements and herbs to accomplish that. That seems like a concept that a lot of people don't get, and they view supplements and herbs as, with some skepticism sometimes.
Yeah, exactly. And I think that's a real disservice. And, the conversation go into the whole way we view healthcare and insurance systems. And, that's a huge topic into itself. And it's very true. I feel like we've lost the idea and the realization that human bodies heal themselves, given the right conditions. I mean, I always use this example when I'm teaching, and I say, like, if you break your arm, you go to the doctor and they put it in a cast and they go see you in 6 weeks. Like, they are not fixing your arm. Your body heals your arm. All they do is stabilize it. Okay. I mean, of course, unless they're putting pins in it, and I always say that, acute accidents, absolutely go to the emergency room. Like, that's the place to go. But when we're talking about chronic conditions, our medical system is not dealing with chronic conditions well. I heard some statistics not too long ago, and it really hit me. It has stuck with me. And it was basically saying, like, for every chronic condition, the more drug options we have out there, the more treatments that we give to it, the higher the incident rates. It's not like, oh, we have drugs for diabetes and now we're not seeing diabetes. No, we're not fixing it. More and more people have diabetes. We have more options, more drugs, more expensive drugs, right? Now we're using injectables. There's like $20,000 a month, right? Or per year, per person. Like, the amount of money that we're putting into treating these diseases, that's not eliminating the diseases at all. It's not preventing them. It's not stopping people from getting them. We're just putting more and more money into treating the end, which is why my passion really, really lies in prevention, and I'm like, if we could take some of that money and put it into teaching people how to live healthy and to really tackle some of the real problems. I know that everybody, I mean, Hawaii is very expensive to live. It's very hard for people to buy super healthy groceries and then cut them up and cook them, right? There's a reason that people default to unhealthy options, because that's what's easy, that's what's convenient. So not only is it teaching people, it's then putting in place systems that make it easy to get good food and to exercise, to walk to work, to not work 3 jobs, so you have time to go play at the park with your kids.
Well, people think about, good health in physical terms, how their body feels, ailments. How important is mental health and mental well-being, and what component of, mental applications, things like meditation, things that straddle mind and body, like yoga or stress management techniques, how important are those to a good health regimen? And are, a lot of those more mental sort of environmental causes really at the heart of a lot of physical illness? So we're not necessarily addressing people's mindsets and creating good health mentally.
I think you absolutely, in that it is paramount. Mental health is tied. It is tied to our body. And I like to explain mental health to when I'm teaching or to my students about how we tend to say like, oh, you know, you wouldn't say to somebody with diabetes, just make some insulin. Just make some insulin, right? Like, you know, get out, stop being lazy and make insulin. But we say that to people with depression, just get up. You know, we've identified these are chemical deficiencies. Now, what's underlying the chemical deficiency could be diet, could be, right? There's factors involved, but you don't tell somebody who has a condition, just snap out of it and get better. And we tend to do that with mental illness, which is really unfair. And I'm thankful that we're starting to have more acceptance and awareness of mental illness as disease states and conditions. That said, it is absolutely tied to our physical body and our physical state. You can have someone in the peak of their life, right? They're super fit, they look great, their body mass index is perfect, and they're completely depressed. That's not a healthy, happy person.
Yeah,
You know,
and probably leads to other ailments.
it does. It absolutely does. It's all part of it. You know, similarly, I've known people at the end of their life who literally have a terminal illness. They know they're dying. They know their physical body is giving out, but they're at peace. And I would just say that person is actually healthier than the young person struggling with a severe mental illness. So I think stress reduction, this is something that I think a lot about, is like, how do you get out of that rabbit trap, you know, that like the hamster wheel trap in the world? Because America prides productivity and we pride working hard. Like those are things that we promote, but that is against good health. It's directly against good health. And I also think that, you know, I hear a lot of influencers and I listen to podcasts and they're like, oh, you know, these special things, this special supplement will do this and that. And that's great. And it's probably true. But if you are not getting enough sleep, if you're super stressed, if like taking a supplement is not going to fix all that. That is, I like to say there's like a hierarchy of like health needs, right? And it's kind of like sleep and water are number one, you know, stress and exercise. And then we kind of move down because, and now short term, our body is designed to deal with short-term stresses, you know, wonderful. We have that from our ancestors. We have our sympathetic nervous system. We get attacked by a tiger and we run, like we have that system. It is not designed for chronic stress.
Mm-hmm.
And the chronic stress just leads to heart disease, diabetes. It's this whole cortisol metabolic dysfunction that is all melded together. And people don't understand that. They're like, oh, well, I'm stressed, but I'm like, no, that is actually giving you disease. That is giving you a disease. And so I like to say, one of the most important things that I will address with people is, how do we either change your approach to what's happening, right? Because I've heard about stress. Either you can eliminate the stress from your, which is, I don't know, quitting a bad job. Like, you know, what do? Eliminate the stress, which is easier said than done, or change your reaction to the stress. Just be like, you know what? I'm not going to let that, which is also hard to do. Yep. But one of the things I really do is problem solve around how do we get you so you have time to actually relax and heal. I remember when I was a student, I heard a fact that like your adrenal glands, your body needs at least an hour of downtime per day to kind of, you know, regenerate the stress hormones you've used. And I remember, and that's not sleeping. That's just like downtime. And I'm just like, I have 2 little kids. Like I'm so in
You're
deficit.
Busy, yeah.
I'm like in so deficit of that, right? Like I think maybe 20 years from now, but it's true. And I feel it, you know, it's very hard. Working parents, I think, really, it's tough.
Yeah, I take my hat off, especially the working parents that made it through the pandemic. So,
Yeah.
you know, but it sounds like it sounds like integrative medicine is very customizable to an individual. Where in a traditional, you know, you mentioned setting a broken bone, for example. You know, there's probably one way to do that, or that's the treatment for. But when you deal with patients that may respond differently, and you have these different tools in your arsenal, you know, are you really customizing treatment to call upon these modalities, you know, to address different people's, not just their health ailments, but different applications that may work differently with different patients based on their situation. So it's not a one size fits all solution to any one healthcare problem.
Absolutely. And that's one of the tenets of naturopathic medicine, which I studied, is treat the individual. You don't treat a disease. You're not like, oh, you have asthma or you have diabetes, or you treat the person and all their symptoms because they are interrelated. And that's one of, I think, the real beauties of the medicine that I practice is it is tailored. It's not like, oh, here's the dose to treat that. So an example there is when we're looking at hormone therapies. So say women going through menopause, quite often, if they're talking to the regular, they're like, oh, hormone therapy. And it's like, it's a set amount. Birth control is the same way, right? It's like, it's a pill, it's the set amount. Everybody takes the same amount. It doesn't take into consideration body weight for one, right? The bigger you are, the more medicine you potentially may need. Two, your liver processing, right? Some people are faster metabolizers than others. So there's a lot of things to take into consideration. So one of the things that I like to do with my patients is I don't just prescribe the off the counter pills. We use something called bioidentical hormones, which are identical to the hormones in the human body. So they can't be patented and they can't be sold by big corporations because they're natural hormones. They exist in nature. But we can adjust the doses. I give them topically in a cream. So one person I'll be like, we're going to start at 1 milligram, whereas I'm like, no, we're going to go right for 2. And then you can adjust as needed. So absolutely, it's very customizable.
How does the patient experience differ in integrative medicine from a traditional healthcare application? You've got a lot of things going on. You've got different modalities coming into play, probably different practitioners that you're bringing in. But give us a sense of what that patient experience is like and how it might be different than what people typically experience when visiting a general practitioner, for example.
Mm-hmm. Well, I think obviously people can have good or bad relationships with any healthcare provider. And there are some wonderful, wonderful, general practitioners that will refer out and kind of do their own integrative medicine in some way. But I think what I hear most from patients who, work with me or in kind of this model is that they feel heard, they feel understood, and they actually feel hopeful that they're going to have their health improved and their needs addressed. Versus the very frustration, people will go kind of from doctor to doctor to doctor, never really feeling that they've hit the right thing. So I think there's really a feeling of there's also a teamwork aspect to it too. Like, let's not forget, we're not just doing something to a patient. One of the most important things is to engage the patient in this model. Like, they're the one that's going to have to make the dinner, go for the walk, take their supplements, whatever it is. It's also, it's a team, and the patient is part of that as well.
So you're really trying to involve the patient in their own healing process.
Absolutely. Absolutely.
So how do they respond to that versus, more their typical experience where they're being given a prescription or maybe being sent to physical therapy? But it sounds like the changes that are identified when interacting, with a practitioner in your space is more about changing lifestyle habits, bringing healthy things into your life. And that's different, I think, than more of a traditional approach to medicine. So talk a little bit about how the patient really becomes a part of that collaborative and not just working with all the practitioners, but they're a vital part, it sounds, of the equation for solving whatever issues they're dealing with.
Yeah, I think teaching and involving the patient is really key. So another one of these tenets is docere, which means to teach, right? So docere, doctor, is actually teacher. And I feel like we really leave that out of most traditional medicine. So I have patients all the time who basically bring me their lab reports that say their GP, they might have a GP through their traditional insurance system or something, and they run a report, and then they bring it to me and they're like, yeah, they didn't hear anything back. Like, they just bring me this long list of numbers, and I'll sit there and I'll be like, well, this is what this means, and this is what this means. And I'll explain to them what hemoglobin A1C means and triglycerides, and, go through it, and they'll just be like, thank you so much. Like, I don't even know why I did this test. I don't even know. And that empowers them. It was really lovely. I had a patient just a couple of days ago email me her most recent lab reports, and she's like, look at this, it's working, it's trending down. And I was like, you got it. She understands now where she wants the numbers to go and what she's looking for. So that's really empowered her. I taught her how to look at her own lab results and to know when she's getting success, right? When she's hitting the number and the threshold. So that's really satisfying for me, and also for the patients, because that's really it. I mean, let's be realistic. Like, even the patients that I see now, like, I won't see them the rest of their lives. We'll come and go and move. But the more you can teach people about how to ask the right questions, how to advocate for themselves, and how to understand their own health, the better. And I think that's partly why I love my job as a naturopathic physician and why I hang on to teaching as well, right? I like really bridge those roles because I love teaching people about health. It's something I'm passionate about. And I kind of think the more people that we have out there asking for the right things and demanding health in general, the more there will be.
Yep, I couldn't agree more. You have an interesting philosophy and one that I think is just really, spot on. You think about health as freedom. And you have a really interesting quote on your website. You say, I believe that health gives you freedom, the freedom to do what you want to do mentally and physically. Health isn't about a lab test or a number. It's about being happy and having the ability and motivation to work towards and attain your goals, whether it's running a marathon, having a baby, playing with your grandchildren. I know natural medicine can help. You are passionate about this. And, I imagine from your life experience as a practitioner, you've seen some remarkable success stories. Can you share maybe some of those in terms of folks that have come to you for help and some positive outcomes that you've been able to help them achieve?
Sure. Yeah. I mean, I think about, there's lots of varied ones that come to mind. One that comes to me is a patient that she still comes to me. She's like a friend at this point, right? So someone I've seen years and years ago sought me out. She was like at the end of her rope. And sadly, you hear this a lot. It's like, I've tried everything. I don't know what to do. And she came to me because she was having these inflammation. She was having problems. It was actually her ear. And they literally, she went to all these weird specialists and they were like, maybe you have this really rare autoimmune disease. And I look at it and I was just like, wait. And it's funny that the things that stick with you from medical school, and it was the smell. And I was like, this is Pseudomonas. It was a very rare bacterial infection that she had. And she'd gone months seeing different doctors and being given all sorts of weird diagnoses. And she's like, nothing was working. And I just kind of went back to basics. And so she's kind of like, you saved me, right? Like it was that thing where it wasn't even super complicated, but it was just really listening to her and looking at it and going, well, has anybody actually taken a culture? Has anybody done an evaluation? It was nothing super naturopathic. It was just really listening to that patient. And so I've now established like a 10-year history with that patient. I've had other moments where it's just kind of like this miraculous shift and you're just like, wow, like this is really, really cool. When I was, I guess you kind of call it a residency, like practicing still in medical school, I used to do a shift a week at a volunteer clinic for people that had either HIV, cancer, or another terminal illness. So it was a free clinic for people that had very little money. And so we used homeopathy a lot, which is, again, a lot of people like, I don't get it. But it's a really inexpensive medicine. And I had this one patient who had severe heart damage due to meth, a lot of meth use. And he was clean at that point, but he had this really, and he came in just presenting like just really far gone. And I remember we're saying, okay, let's try. And we did acupuncture, we tried this free, and he came back the next week, like I'm telling you, like amazingly better. It was one of those like, absolutely, you're like, what did I give him? Like a miracle drug. It was just the recovery. And I think part of it was, again, the care, right? The caring. Another thing that's just really, really, it's always just really exciting when you're helping women in their fertility journeys, women who want to have babies. And that's, again, an area where natural medicine and integrative medicine is so important because it is so multifactorial. It's not like just the ovaries, right? We're talking stress, we're talking nutrition, we're talking all of these aspects. So seeing women have babies and then treating their children is one of my favorite things. I'm really passionate about kids. I started my journey in pediatrics, and although that's not what I do exclusively, I really like working with kids. And they're also fun to work with because kids are they bounce back so quick. They're so vital, they've got such great energy that they can get really sick, but then they can get really better. And to see the growth, like having kids in your practice, where you're like, oh my gosh, I knew when you were an infant and now you're 10, that's really amazing. And to help the family the whole way, to like know the whole family is really cool.
A lot of your work, your research, some of the published works that you put out focus on understanding how chemicals and toxins affect our health. You've said in the past few years, I've grown more and more concerned about synthetic chemicals and their negative impact on human health. Can you tell us a little bit about how some common chemical toxins that are found in our everyday environment can affect our health? What are some of those sources and what are some of those outcomes that they affect in our health?
Sure. Yeah. So first of all, I want to kind of preface that with like one of the reasons that I got really passionate about this was one, as a consumer, as a mother, I was looking for the safest, best products for myself. But it was also in my practice dealing with patients where, you've checked all the boxes, you've run all the tests. You're like, why aren't they getting better? Like all the things that should be working aren't working. There has to be something going on at a deeper level. Like, something that, and what started to occur to me is the chemical exposure that people either got occupationally or at home, or, like literally this toxicity on this deep level. And I really believe that is a real hindrance to a lot of people healing. So the things that we know, I think, since the 1970s, I think it's been like 88,000 chemicals registered for use in the United States. Like 88, like that's so many new chemicals. Our human body is like, we've been dealing with the same things for like thousands of years. And all of a sudden in the last 50 years, we've introduced all these new compounds into the environment. And some of them are ubiquitous, like plastics, right? Look at everything, we're surrounded in plastic in our daily life now. Plastics we know now, right down into microplastics. Not only are they hurting the world, they're hurting us. And the major things with plastics is we see endocrine disruptors. So in terms of health, there are contaminants in plastic that mess with our hormonal systems. So when we look at any sort of fertility issues, women's health issues, so endometriosis, PCOS, like all these things that we're like, oh, it can be directly linked to chemical exposure. Neurotoxins is another huge aspect. There's another huge group of chemicals that we know interrupt proper signaling of our nervous system. Like, and you look at the diseases, the degenerative brain diseases, the behavioral disorders we're looking at children, like we look at the numbers of these. Well, of course, these chemicals have been introduced. And then finally, we see carcinogens. So many of these chemicals literally either stop our body from recognizing and fighting a cancer cell in our body or somehow promote it. And if you look at the rates of cancer, especially in young people, that's one of the things that literally scares me most is, we should be living longer and better, and we're not. The rates of autoimmune disease and cancer, which are specifically linked to these carcinogenic compounds. So those are kind of three classes that I am most concerned with. And I think we're seeing the impacts in our world right now.
Yeah, I agree. And, I've seen some of these studies that have come out lately showing that life expectancy here in the United States is going down. In a wealthy country with most having access to the basic necessities, we're seeing lower life expectancy. And we've all seen how the United States is dealing with obesity as a crisis in this country. And I imagine that's all linked to the foods you eat, the toxins in your environment, things that in some cases might be beyond your control.
Absolutely. Yeah, no, and obesity is a great one because there's within this whole group of chemical compounds, there is actually a group that are known as obesogens. And they bridge some of the endocrine disruptors and the carcinogens, and they actually have been shown to change the way your body deals and processes fat, right? So studies have actually shown that, and I believe these were rat studies initially, we haven't, done them on humans yet, but that pregnant animals who are exposed to these compounds, their babies are born with more fat cells, meaning they're predisposed to be heavier, right? So they're predisposed to obesity from the get-go. And then we look at all of these chemicals. I would say the majority of them, I'm not going to take a guess on percentage, but most of them are fat soluble, which means if you're exposed to them, your body is like, well, I can't just pee it out in water, right? In your urine, which is water-based. You need to try to sequester it somehow. You need to hide it. Well, what's the best way is to store it in fat, right? The fat will kind of package it up and stick it in somewhere and hide it. And your body's literally trying to protect itself from these toxins. But what you're doing is you're holding on to the toxins. I actually think that's one of the major barriers in fat loss as well. When people start on a weight loss journey and then they just feel really crappy. And unless you're kind of supplementing the actual fat loss without a way to remove these toxins from the body, people just get very discouraged because they feel crappy. You're exposing them to these toxins, which can be dangerous and is kind of counterproductive.
Yeah, and you know, we've heard some of these stories that have come out lately about drugs like Ozempic as the miracle weight loss drug, and you know, it seems to me like that is a short-term fix to a long-term problem. You know, what's your point of view about using drugs to solve problems like obesity without integrating lifestyle changes, for example? It seems like it's a short-lived solution, and they're going to be right back at the table dealing with it down the road.
I agree 100%. I think there's very few people that start taking a drug like that and then are like, oh, I'm off it, I'm fixed, right? It's not designed that way. It's designed because what the drug is doing is it's changing the physiology of your body, right? Like it's changing your receptors and how it's basically increasing satiety. Is what it's doing is it's an analog of a peptide that we have in our own body. So it's basically saying, hey, you know what? You're filled, you don't need to eat anymore. Well, as soon as you stop taking that, you're gonna like rebound back. So if you haven't taught people how to exercise and how to maintain that health. Now, I think there's a lot of people who've been really helped by that drug, right? And this is where I'm always like, don't throw out good medicine, you know, for people, if that's like any sort of you know, if your choice is death or a drug, we'll take the drug. You know, like if you're at that point where you're really struggling, then if that is helping you move in the right direction, that's great. But when you look at the numbers, when you look in general, as I said a little bit earlier, like do we really think that somehow we're going to cure obesity by giving everybody this drug? Like, how's that going to work? Because we're not targeting people who are still getting fat. Right?
Yeah.
Like we're going to start giving to children. That doesn't make any sense. Unless we actually tackle the root, which is, okay, how do we address that? And I want to acknowledge that I am not at all like, oh, just eat better and exercise. Like that's difficult, you know, like it's not easy for people who have time and have money. Those are difficult things to fit in. And obesity is recognized as a disease. There are endocrine aspects. It's, you know, some people are predisposed and have the genetics to make them heavier. So that they're fighting like an uphill battle. So I don't want to kind of make people feel like, oh, if you just try harder. No, that's not it. But we need better tools. We need to put work into the prevention. We need to go, okay, if this is a problem in your family, then let's implement some tools, even with your kids now, so that they aren't going to have to deal with this life, you know, long term. And the other thing is when you look at something like, you know, Ozempic, we don't have long-term studies on that yet. You know, I mean,
yeah, it's new.
It's new, and hopefully there's no massive issue later on, but who knows? Who knows?
Yeah. You know, I would argue that, I mean, it's nearly impossible to stay fit in our society today. The availability of food, the preservatives that are in food. I mean, you have to really go out of your way, probably do a large amount of your own meal preparation just to have healthy food on your table, make a point of exercising. And I know I have friends and even myself who sort of, you know, focus a lot on healthy eating and exercise, and it's still a struggle to stay fit in contemporary American society.
It is because we are surrounded with an abundance of calories and fat. You know, when you look at evolution or like the human body is designed to look for sugar and fat. That's what we needed. Like, you know, when you were out hunting your animals and gathering your food, and those were the treats, you know, if you found fresh berries, if you found like, those are the things that would sustain you. So literally our taste buds are against us in this way, that they love sugar and fat, which is fine when you were out climbing trees to get fruit. And, you know, like when you're out then you had to work really hard for your calories. But now you can buy donuts on like every corner, right? Which is, I like donuts is your
Or
ultimate.
malasadas here in Hawaii.
Yeah, exactly. And so it's just so abundant and it's hard to say no. And especially when we're stressed. I think the number one thing people crave when they're stressed is they crave sugar, right? They crave sugar. There's this reaction with the cortisol and it makes it makes them feel better, and then they feel worse, and then they want it again and they feel worse, and they feel, like it's such a bad cycle. But you're absolutely right. And I don't know the answer to that. I know there's a lot of projects that are looking at making fresh food more available, more appealing. I mean, the push of farmers markets, even things, there's the real trend towards healthy supermarkets. If you look at Whole Foods, I mean, it's done amazingly well. But just shopping at Whole Foods isn't going to make you healthy. Like, they also have a really big potato chip section and chocolate section, and like, sure, they've got great produce, but just because you buy your food there, it doesn't mean it's great. So it really is a challenge. And I mean, we live in Hawaii here. It's beautiful year round. We have attempted a garden several times, but between the 2 jobs and the 2 kids, like, the garden doesn't do super well. And maybe someday I'll get to grow more of my own produce. And I love that. I mean, we live in a neighborhood where people share their mangoes and their lemons and everything, but to actually be able to actually, it's work to grow food. And it's just not realistic for most people, even if you live in an area that you have nice weather and land. It's just not, like you said, not sustainable. So I think we need some really, really big changes in order, if we really want to impact health and we really want to change these trends that we're seeing in disease.
Yeah. Do you think movements like the move to plant-based foods, free range and organic foods make a difference in people's health? Just looking at organic produce that you can buy, is that worth doing? Is that something you'd highly recommend because they're not exposing those plants or those animals to toxins and antibiotics that will eventually make their way into your system?
I do. I am a strong advocate for going for organic foods whenever possible. I understand for, some you can't get everything organic sometimes. But yeah, I fundamentally believe that the fewer toxins, the better off you're going to be long-term, right? So I am a really big advocate of that movement. You're talking about plant-based diet. I think it's impossible to choose one diet for everyone. And there's so many trends right now. Some people are like carnivores or keto diet. I mean, they all have pluses and minuses. And depending on your body and your life and your metabolism, that there isn't one that is right for everybody. In general, I think if I was going to make one blanket statement, I think more fruits and vegetables for everybody would be fine. Now, that maybe doesn't go, is a little against the whole carnivore people who are trending down that way. But I mean, study after study after study for 50 years, right? It has been shown people who eat more fruits and vegetables tend to have the lower incidences of cancer. The phytochemicals, the nutrients in those are really important. So then, in kind of the organic food, are you better off with organic potato chips or conventional broccoli? Oh, that's a tough one, right?
Is it a tough one? I would think the broccoli would be the hands down winner there.
No, it is. Absolutely. Absolutely. I mean, if you're looking organic, non-organic, but that's kind of what I say to my students is, don't think just because it's organic that it's necessarily healthy. If you're going to buy potato chips, no matter what, buy the organic ones. But no, I mean, you're better off eating fruits and vegetables rather than junk food. That's another thing in the plant-based sector or the vegetarian sector. I think that's something a lot of people fall into, where they're like, oh, I'm not going to eat meat. I'm like, did you know that a vegetarian could survive on French fries, mac and cheese, and potato chips? Like, that would be possible. That's not a healthy diet.
No, it's not.
Right? That's not what it's meant to be when you say you're going to be a vegetarian. That's not how it was intended.
Yeah. No, I went vegetarian for a little while, and I know I struggled to eat enough protein. But I will say, if you want to lose weight, that's a great way to do it.
Well, yeah,
yeah.
I mean, any shift to the diet, like I like to say, when people do want to lose weight, I'll be like, okay, let's make a change, right? Sometimes let's go gluten-free, because anytime you take something out of their diet or make them focus on something, it eliminates the volume. It takes out something that they were eating. So the change, and obviously when you're eating a lot of fruits and vegetables, you're getting a lot of fiber, which means you're going to fill up sooner, and you're not getting these really calorie-laden foods. So yeah, fruits and vegetables are kind of, I think, important for everyone.
Very important. Let me, for our listeners that are interested in a career, in integrative medicine, what would you recommend? How do you start? How do you pursue some academic credentials or professional credentials that get you started as a career path in integrative medicine?
Well, the first thing in America would be doing an undergraduate degree in, I suggest biological sciences, right? Something that's going to get you your kind of prerequisite classes and expose you to human health, right? The more human health exposure, I think, one, that's going to prepare you, and two, hopefully that will excite you, right? Because if you get into your like human anatomy class and you're like, oh gosh, well, then maybe you're not on the right path. So it's a great exposure. So something that's going to show you human anatomy and physiology and, nervous system, biochemistry. I mean, biochemistry is fascinating. We are chemical beings. That's what we are. So an undergraduate biological sciences, biochemistry, something in the sciences, because you need to be able to prove that you can handle these sciences. And then what I like for students to do is, take a couple years and then be like, well, what are you really drawn to? What kind of avenue are you really drawn to? And this is one of the things I love in my role at HPU, is kind of mentoring our pre-health students. And I'm like, okay, if you love sports and the anatomy, then maybe physical therapy, occupational therapy, maybe that's the direction. If you're like, no, I really want to talk to people, I want to have like one-on-one conversations and see them throughout their life, then maybe more like a GP path or a general practitioner path is where you're going to go. So in that way, you have an option of maybe medical school, DO school, or naturopathic school. If people are like, I'm into nutrition, I'm into like holistic medicine, then I'm going to say, well, follow the natural path. So I think over my time at HPU, I've pretty well helped people walk down all these different paths, right? From physical therapy to medical school, to occupational therapy, pharmacy, chiropractic, depending on where their passion truly was.
Great. Well, Allison, this has been a fantastic conversation. How can our listeners connect with you or learn more about integrative medicine if they're interested in elevating their own good health? How can they connect?
Well, they're welcome to contact me through my practice. My website is drallisonbachlet.com. I'm sure you can spell that out there. And I also, if anybody's interested in following me on Instagram, I like posting, like reels and short clips about health related things, like I'll be like, here's the sunscreen I use for my kids because this is the one I think is best, and things like that. So that's Naturopathic Mama. So at Naturopathic Mama. So yeah, people be welcome to reach out to me if they have any direct questions.
Terrific. Well, I hope many of our listeners do that and elevate their own good health and learn about alternative and integrative ways to really create the kind of lifestyle and good health that I think we all seek. So thank you for your time, Allison, and hopefully you'll hear from some of our listeners and can help them live better, healthier lives.
Great. Thank you so much.